Okay, good afternoon everyone and welcome to our event, Reopening of Personal Care and Close Contact Services. This is another of our series of webinars aimed at supporting businesses and organisations with information as we follow the government roadmap out of lockdown. Today's event follows a further webinar yesterday for the sector, which was focusing on businesses in the north area of Warwickshire. Today is primarily for businesses in the south of Warwickshire, but everyone is welcome to join and participate. The next step in the roadmap comes next week commencing 12th of April, when businesses providing close contact personal care will be among those able to reopen. Hence, we're hosting this recorded event today to help with information and answer any questions you may have. We'll provide a brief current COVID-19 picture for Warwickshire with some public health advice on close contact services and the support that's available, and touch on local lateral flow testing, and then we'll give a brief overview of the changes coming for the sector next week. The webinar is brought to you today by safety and regulatory colleagues from local borough, district and county councils, Warwickshire Police and Fire and Rescue Service. Many thanks to our partners who've helped us to plan and promote the webinar today. Please note this event is being recorded, so should you remain logged in, we take this as your consent to take part. It will be uploaded to the Warwickshire County Council YouTube page, so feel free to share it with colleagues who couldn't join. The information provided today is current and correct to the best of our knowledge on the 7th of April 2021, so please note this if you're viewing at a later date. The format will be for our panel to introduce themselves. We'll then cover some key points from public health and changes in the sector, and then we'll open up to your questions. You can raise your hand or post questions in chat at any time. My name is Ian Flynn and I work at Warwickshire County Council, and I'll be your facilitator today. I'd like now to introduce our panel. First of all, Aaron.
Good afternoon, everybody. My name's Aaron Coursey and I head up the Town Centres and Tourism team at Warwickshire County Council, and we also help run the Warwickshire Towns Network, working in partnership with the districts and boroughs, helping to reopen their high streets.
Thank you. And Emily.
Hi, I'm Emily van der Venter, Associate Director of Public Health with Warwickshire County Council and jointly employed by Coventry and Warwickshire CCG, supporting prevention and management of outbreaks within workplace settings, as well as having a lead around mental health and wellbeing for the county.
Thank you. Jonathan.
Good afternoon, everybody. My name is Jonathan Toy. I'm the Group Manager for Trading Standards and Community Safety for Warwickshire County Council, and I'll be working with regulatory and public health colleagues as part of a twice weekly meeting that looks at all the regulations as they've come in and changed since March of last year.
Thank you. And Nicola?
Good afternoon, everyone. My name is Nicola Hoare. I'm the Food and Safety Team Leader for Warwick District Council and have spent the last 12 months fully immersed in all matters COVID.
Thank you. And Dee?
Good afternoon, everybody. I'm Dee Keegan. I work as an Environmental Health Officer with Stratford-upon-Avon District Council. So we're working quite closely with local businesses to provide encouragement and advice for a safe reopening.
Thank you. So, Emily, can I call on you to give us some of the key headlines for Warwickshire?
Of course. So I will just share my screen just to give viewers the overall picture in terms of number of cases in Warwickshire most recently. So we've got the rate and the number here of cases in the last 7 days, and I'm pleased to say we're continuing with a nice downward trend. You can see from the map here, actually, we've had fewer cases in the south of the county, higher rates still within areas in the north, but those are also coming down. So if I just flip to this slide, you can see the figures there. So overall, Warwickshire at 47 per 100,000 cases, and then a range across the county between 25 and 107. So better than we were, but still important to remain cautious, keep practicing all those prevention measures around hands, face and space. And importantly, ventilation is really key as well. So looking at having windows, doors opens when you're having customers or having any team meetings on site. I'd also like to make people aware that we've obviously had the announcement that all adults are now entitled to twice weekly lateral flow tests. So these are the rapid tests that will give you a coronavirus result within about 30 minutes. So you can collect kits to take home with you from our test sites. We have 6 community rapid test sites across Warwickshire now, and you can access those. You can book in for a slot through warwickshire.gov.uk/coronavirus community testing, or just Google community testing Warwickshire. You can book in. What we do recommend is that people go to a test site to have one test taken, so you understand how to do them properly, and then you can take some kits home with you. You can also pick up kits from the PCR test sites, so the sites that you can book into via nhs.uk/coronavirus, and those are the test sites for people to go to if you have symptoms. So they've changed. They will do the PCR tests in the morning up until about 1:30 for people with symptoms. They'll then close for a bit, do a deep clean, and then open up for people to come along and pick up the lateral flow, the rapid test kits. So would really encourage you, obviously with the close contact nature of your business, to uptake that offer and encourage your employees to access twice weekly lateral flow tests. So they're best taken about 3 to 4 days apart. And the idea of doing the regular testing is really that you can pick up the infection as early as possible and then prevent people coming into work who may be infectious, and obviously with the risk that entails to customers and your wider staff. That was my key points for now. Thank you.
Thanks, Emily. Thank you. Nicola, could you just give us some quick broad headlines about next week?
Yeah, broad headlines is we're back where we were just before Christmas, really. So it's putting into practice all the really good COVID secure measures that you had in place then. Specifically, obviously, as you're walking into the premises, you need to make sure you have your QR codes in place. And also have some sort of system of logging details of your customers should they not have access to mobile phones. I'm thinking perhaps for those of you that have a service that is perhaps geared towards more older clients who might not be quite so tech savvy as the youngsters. You suggest that you have sanitizer at point of entry to the premises so that customers can clean their hands before they come in. Make it very clear that the expectation is that your clients must be wearing a face covering when they come into the premises, and also to retain that face covering on throughout the whole time they're on site. Similarly, you and the rest of your staff need to be wearing additional layers of face protection. So that would be a face mask and a clear visor, not an either or. In order to protect yourselves, then you need to be having both in place. And this is certainly the area where we've had the majority of complaints made to ourselves directly and through police colleagues. It's in relation to people being seen in premises without the appropriate face coverings in place. Obviously, get customers to their seating areas as quickly as possible, making sure that the seating is ideally 2 meters apart, and refrain from giving customers refreshments. It's a bit mean, but I think we've all got used to the idea of a quick in, get the haircut and out again. And as Emily says, increase ventilation. So keep the doors and windows open. It might well be worth giving your clients a bit of advance notice that you are trying to keep the area as ventilated as possible, and to make sure they've got sort of a good thick coat or jacket or something with them, just to keep them warm whilst they're sat still for the duration of their titivation. Also bearing in mind that what we found with workplace outbreaks generally is that quite often people are quite good when they're customer facing. It's what happens when you go behind the scenes, you go and make a cup of coffee, and you catch up on the local gossip, and it's again making sure that you're retaining social distancing right across the piece. So it's not just when you've got customers in sight, it's throughout the whole time you're actually on the premises. And I think that's probably it as a bit of a snapshot overview reminder as to where we were and what we're expecting to see in place for from Monday onwards.
Okay, thanks, Nicola. Before we go on to questions, was there anything else the panel wanted to mention?
If I can just touch on, Nicola's mentioned the QR codes and the need to record customer details. So that's really important in terms of if obviously you do end up having a positive case either amongst one of your customers when they've been on site or a member of your staff. And we would, whilst any positive case obviously will report close contacts through the national test and trace system, we would ask businesses to do their own double checking really of any close contacts. So as well as isolating individuals who have had a positive test for 10 days from their date of test or the start of their symptoms, if they've had them, it's also really important to isolate those close contacts in order to reduce risk of any further spread. So anyone that's been within 2 meters for 15, so 1 to 2 meters for 15 minutes or more, and that can be a cumulative period of time. So it might be 3 5-minute chats throughout the day, or anybody that's had either physical contact or direct contact within 1 meter would also be considered a close contact, as well as anyone sharing a vehicle or being in the same household as a positive case. Thank you.
Thank you. Any other comments?
Yeah, could I just add a couple in, if that's okay with you? Two, I think for me, just to add on to Emily and Nicola's input, is where you're doing work which is close face-to-face work, think obviously very carefully about that, because the guidance before has been very clear not to do close face-to-face work, so facials, eyebrows, all those kind of elements. And I think our view at the moment is we'd probably suggest you hold to that advice as well at this moment in time. As lockdown eases, I'm sure some of those more close contact type working will become more customary, but I think right now I would probably suggest avoid doing them for this time. The important thing is to get the business up and running and operating, and I think those are kind of other elements are things that you're looking probably in the May time rather than in the April period. The other element I think we've got to be very mindful of is how you manage your customers in terms of when they're coming into the premises, and doing your very best to think of the environment that your business is placed in. You know, so if you're in a very busy part of Warwick or Stratford and there's a lot of footfall and you've got customers queuing, how do you manage that? What's the impact on that? What's the impact on the premises next to you? And how do you make sure that your queue, if that does start to build up, that you can deal with that? Because ultimately, if they're your customers, there would be a view that they're also part of that your responsibility as well. And what we don't want to do is have lots of complaints about businesses where there's either large queues building or that there's lots of people waiting for an appointment inside the premises, and that is the kind of thing that we've had before. So anything on pre-booking that you can do, anything you can minimise the chance of a queue building up, building in enough time to clean down stations where you've had someone in a chair or doing a particular piece of beauty treatment. Just build those in to that time period. I know a lot of that was done before, but we can't reiterate in the strongest term how important it is, because as of the 12th, it won't just be your business that'll be reopening, and the high streets are likely to be a lot busier because people are very much looking forward to personal care, hospitality, non-essential retail all opening next week. So we want to make sure all of the town centres, all of our busy areas are as safe as possible, not just the individual premises.
So it sounds, Jonathan, like we would discourage walk-ins. I know a lot of businesses in this sector operate on that basis, don't they?
I'd probably slightly change the nuance on that question, Ian. I'd probably suggest we would encourage pre-booking. I don't think we can say to business no, but I think it's very much understanding the added complications of walk-ins at this moment in time. There's a lot of people who are really looking forward to personal care reopening. I have to say, in my team, aside of the vaccination chat, when you're going to get your haircuts or when you're going to go into the hairdressers is absolutely top of the list. I can see lots of colleagues nodding at exactly the same point. So it's really being looked forward to. But the problem is that I know lots of the hairdressers and barbers who are running pre-booking systems are already booked up. So if you're then going to run a walk-in, the chances are you're going to be really, really busy, and that's going to have a knock-on effect. And what we don't want to be dealing with is complaints about businesses. You know, our role right now is to get this sector back up and running and working and supporting businesses. We don't want to be dealing with complaints. Absolutely, that's not where any of us want to be. So that's why I think the encouraging pre-bookings, absolutely, Ian, we can't discourage, but understand the impact that having a walk-in service might have on your business and on the environment that you're in.
Yes, I'm just looking here at some feedback we've had from Warwickshire Police on common calls that the police get regarding this sector. So I'm happy to run through these unless anyone else wants to. But it's face coverings, both staff and customers is one thing. Staff standing in huddles while they're working or waiting for customers. Social distancing of clients in waiting areas. So again, that touches on what Jonathan has said about walk-ins. No track and trace register taken. Lack of hand sanitizer for customers and staff then not isolating when required. I'm sure these are all things that colleagues on the call are familiar with.
There's certainly things that come up regularly in our twice weekly meetings, partnership meetings. I'd again, just on behalf of all of us, but particularly myself and Nicola and Dee, I'd also say we get an awful lot of positive feedback about hairdressers and barbers and personal care services as well. They're running a really, really amazing service, pre-booking, very well managed, brilliant hygiene arrangements. We had a call yesterday, didn't we? I think a number of us were on with members of the sector from the north of the county talking about the arrangements that they'd put into place. It's an enormous amount of work. I don't actually know a sector that has done more. You know, the things like personal, perspex coverings, screens, visors, changes of equipment, changes of layout. So there's some fantastic work that's been done by businesses in the sector. I think we should commend them as much as, there's a few things that the police might well highlight, but on the whole, the vast majority of people have worked really, really hard and tirelessly on this. And as I said before, for all of us, we want this sector to reopen and be really successful. So noted from us, but let's not lose the good positive element as well.
Yeah, thank you, Aaron.
And to follow on that with the positivity, all of those businesses that have been recommended for great service, great working ethics, all of the protective equipment will keep getting repeat business. There will be businesses that thrive over the next 6 months. we appreciate how hard it is out there at the moment, and it's gonna still be hard for a few months because working practices are different. We can't have that throughput of customers like we had a year and a half ago. But absolutely, being positive and learning from the good examples of what's going on out there should make the businesses thrive going forward. So it's that positivity here, that looking at the positive aspects of having a booking system will actually in the long run create a stronger foundation of a business as well.
Yeah, and touching on Aaron's point there, we are launching, we have announced with Coventry and Solihull the CSW COVID Business Pledge, and this is a pledge that local businesses can sign up to, committing them to all the things they should be doing, but it provides confidence for staff and customers. So it covers distancing and face coverings and testing and tracing, but also things like ventilation, and also businesses in Warwickshire, if they sign up for it, that they'll qualify for support from the Employee Assistance Programme, EAP, which staff with financial or other worries, mental health issues, can access online tools or call a helpline. But we'll post some information about the pledge at the end of the webinar. So we'll move perhaps now to some of the pre-submitted questions. One of which was around temperature checks. So do we recommend businesses to take temperature checks of staff or customers, or both?
Happy to take that one. So it's not something we particularly recommend. It's not a very robust way to identify COVID symptoms. Not everybody will have a temperature, and we've probably had more instances of workplaces where they've got temperature checks in place saying they had their temperature checked and yet later that day on their shift they developed symptoms and came back positive, than we've had people being prevented from entering the site following a temperature check. What we'd say is where businesses are doing temperature checks, the important thing is to use it as an engagement opportunity. So actually a better check is just to talk to people, check whether they've had any symptoms either amongst themselves or within their household, or any recent contacts, and really just do that screening. So we know about the top 3 symptoms: the high temperature, the change in taste or smell, and a new or continuous cough. There's also wider clusters of symptoms. The WHO's got some really good information on that, but things like fatigue, headache, sore throat can also be a sign of COVID. So it's just worth having that conversation really, and checking with people is probably better than temperature checks.
Okay, thank you. Aaron's posted there in chat. If you'd like to, if anyone would like to ask a question or make a point, they can either raise their hand or post it in the chat section. Another question here around bringing staff in before the 12th. So I guess that would be tomorrow now, or Friday or Saturday. So bringing staff back in to do some training before they start back. This was allowed apparently after the first lockdown last year, but it's not referred to specifically in any of the guidance that's available. What would you say on that?
I'm happy to take that one in. We think it's a really good idea, and we would encourage people very much to do it. Just get people familiar again how you're going to operate the premises, how you're going to operate customers, sanitizing, all the things that Emily was talking about in terms of drinks, how that will be managed, even drinks for staff as well. I know a number of personal care settings have actually said to staff, you know, bring in your own mugs now and bring your own coffee and your own tea, or bring in your own thermos, etc. So all those kind of elements, just talk through those with them. I think our view is also it's a massive opportunity to check on how your staff are, because they'll have their own issues and challenges, and it's really helpful just to be able to talk that through with them and offer them the support that we've mentioned earlier. If people want to use the REAP support and you'd like to sign up for that, it is free of charge. No business is going to be costed for that. So it's available to you all. So you're very welcome to contact us on the link I think Aaron's provided, and then we can give you that support. But that well-being of staff for us is just as important as that familiarisation of how the business will operate, and it's a great opportunity to spend a couple of hours with your team if that's possible in advance of that. So yes, definitely encourage it.
Okay, thank you.
I think I would just add to that, Ian, you know, the biggest risk we see at the moment is people spending prolonged periods of time together in enclosed spaces. So that's why ventilation is key. But I suppose I was just thinking, if you're bringing employees back in, absolutely do that walkthrough around the processes you've got in sight. But if it's when you're kind of having a bit of time for a chat, if you can do it outdoors, that's obviously the safest way to do it.
Sure. Okay. Thank you. So we had some general questions about face coverings, but I think we've covered that. And there were questions about taking personal details for test and trace and the displaying of the QR poster. But I think, Emily, you've dealt with that, haven't you? And keeping customer records.
Yeah, so that needs to be done and kept for 14 days.
14 days, yeah. Dee, you've got your hand up.
Yeah, I was just going to say, I thought it was 21 days.
My apologies, 21 days.
Just to keep records for 21 days, yeah.
Thanks, Dee.
We're just checking you were listening, Dee. Thank you. And then in terms of how often businesses need to clean their equipment, I'm guessing that's the same as it was after the first lockdown.
Yeah, very much so. It's really important to clean down chairs, equipment, anything you're using with the customer. Make sure they're cleaned down between every single customer use. Shared facilities, really important, often get overlooked. So if you do have a shared kitchen, if someone's gone in to make themselves a coffee or sit down, have something to eat, make sure there's some wipes on the table to make sure things are properly cleaned down afterwards. There's different levels of products out there which you can use and research. It's again all on the government website on what is good products in terms of its quality and its strength. But definitely make sure that those facilities are there. People know how to use them when they use them. Toilets as well, same scenario. And anything you've got, any facility where your customers are in regular contact with it. So again, we were hearing yesterday from one business that's got a bell at the front door that the customer rings. And then someone comes in and lets them in and takes them into the waiting area. If that's a bell that's being used by 20, 30, 40 customers in the day, it needs to be wiped down on a very regular basis, if not even after every single time someone is using it. So any of those areas where there's a regular contact point, payment cards, payment machines, anything of that nature, really pay attention to those. And if you're using disposable coverings for your customers, again, make sure that they are properly disposed of, not just kind of left in a pile somewhere. Make sure they're properly binned and bagged up. So yeah, all those little bit of details can absolutely help. But I would just reiterate again the point that Emily has said before. Ventilation, absolutely critical with the new variant. Social distancing, in terms of the layout of your premises, absolutely essential with the new variants. And then the other elements around PPE and hygiene, equally as important as they were before, but it's the ventilation, the social distancing that we've seen has had the biggest impact on the new variants because of the way that they spread.
So something that may be relevant here that came up on an earlier webinar was around, obviously not every provider of services will have their own WC facilities on site, but in terms of the use of hand dryers, are they permitted? Are they advisable?
So we're advising against those at the moment. Guidance from PHE from last year did say they were okay, but actually now we know the new variants are more spread by aerosol transmission. Actually avoiding that blowing of air around is best. So paper towels and then a foot operated pedal bin with a lid is the best way to clean hands and dry hands, and obviously make sure the bin doesn't overflow. The other tip around toilets is to have hand sanitizer on the way in. So you're just reducing the risk around people touching multiple things. And again, if you've got a window in there, open it up.
Okay. And this may be a no or too general a question, but the personal care close contact services obviously includes hair salons and barbers, but it's quite a wide sector, so it includes I guess things like tattoo parlors. Is there any specific advice for any of those specific niche members of this group that you wanted to highlight? Anyone on the panel?
I think I could add that historically our tattooists are probably the most switched on in respect of infection control and PPE. So in addition to making sure that they're wearing the appropriate face coverings, I think just carry on the really good work that they've been doing from the start of the process and prior to COVID. All of our tattooists who are registered have access to hand washing facilities as well. So again, customers and clients can be confident that when they're going to have a tattoo, that they're going into a COVID secure environment.
Thank you.
I think the other area we haven't touched upon in the past is people within the personal care sector often or would be available to do haircuts, hair treatments in someone's own home. Is that right? From the 12th, I'm just looking at colleagues, and Nicola's nodding. I think Dee and I, or Dee, myself and Nicola have had a similar conversation, haven't we? So that we believe can take place from next week, which is a bit of a change. I think we'd all say, really be vigilant when you're booking those appointments. Again, what equipment you need, the hygiene, the cleansing. What's your advice to the client before you're going into the home? So I know, again, hairdressers last time were saying happy to come into your own home, but we don't want to come in contact with anybody else there, only just yourself. So please send your partner or your children or your loved ones away for a few hours while we do the treatment. I think it's important on those, reiterating those messages. The cleansing, the personal equipment, making sure that the person, even in their own home, is actually wearing a face covering, because it becomes an extension of your salon. So all of those things, go through those elements of a risk assessment with real vigilance if you're doing any of those treatments within someone's own personal home.
Yeah, good points. Thank you. So I'm not seeing any additional questions posted or comments, and we have covered all of those that were pre-submitted. So I guess I'd open up this section to anyone on the panel who wants to bring any final comments or questions in. I know, Emily, you mentioned you'd like to say something about the mental health services provision, which is a key concern for us all at this time.
Yeah, thanks, Ian. I think obviously we've had over a year of dealing with the pandemic now and the anxieties that brings. We've all had different challenges and different ways of coping. And the reason I wanted to mention mental health and wellbeing on this webinar is because of the nature of the relationship you have with your clients in that close contact businesses. And potentially you might spot people who are having difficulties, or you may have customers open up to you that they have been struggling. So wanted to just really signpost you to warwickshire.gov.uk/mental health. There's lots of information there in terms of the services and support that's available locally. We've also got a Dear Life website, so that's dearlife.org.uk, and that's a site we launched last year specifically around suicide prevention. So there's information and support for people who may need help now, who they're struggling, if they're worried about somebody, and really tips to start the conversation around asking people how they're coping, and really asking directly if people have ever had concerns around taking their own life. Can be a real lifeline for people, just to allow them permission to open up. So if people do, you just have to listen. You don't need to try and fix the problem for them, but actually having a listening, sympathetic ear can be really important for people. And then that website has further information on support that people can be signposted to. So there's always the Samaritans, 116 123. They're excellent, but we also have more local support available that you can have a look at on the Dear Life website. I'd also recommend that you have a look at the Zero Suicide Alliance. They have some really short training videos. So they range from about 5 minutes to an hour, depending on the level you want to engage with. But again, just helps to give you some tips around how to talk about mental health and suicide risks. We know at least 1 in 5 people are struggling with depression and or anxiety at this stage, and particularly if people have been through a bereavement or if they've had COVID themselves, then again they're increased risk of mental health difficulties they will be experiencing. So please do take note of that, and I'll just suppose give a thank you to all of you who support your clients.
Yeah. Thanks Emily. Important information that we can share with the right people. We'll post some of those links at the end of the video. So if there's no further comments or questions, I think we'll draw to a close there. So thank you to the panel for your time this afternoon and your preparation, and thank you for those who tuned in or who tune in at a later date. If you've got a public health related inquiry, you can send those to phadmin@warwickshire.gov.uk, or if you have an inquiry but you're not quite sure where it should go, if you send it to business@warwickshire.gov.uk, we'll forward it on to the right people. And as I say in a moment, we'll post some useful links, including a link to the County Council YouTube page where you can watch this and other recent webinars on reopening of the economy. So on behalf of the panel, I wish you all the best with your businesses next week, preparations and a successful week. Hopefully we'll have a bit of sunshine to get some people back safely into your businesses. So thank you very much.
Thanks everybody.
Thank you.
Thank you.
Thank
all.
you.